Now, on Monday, June 17, 2024, the Medical Laboratory Professional Workers Union commenced a nationwide strike in response to prolonged delays by the Fair Wages and Salaries Commission and the Ministry of Finance in concluding negotiations with the union. According to the union, the strike will affect services provided by their members in medical laboratories, blood banks, pathology laboratories, and selected mortuary facilities across the country. Said you visited some health sectors. We'll bring you the details. But for now, let's speak with Dee Baba, who is standing by to bring us the effect of it from the other regions. Dee Baba, thank you for your time. You're welcome. And good afternoon to you.
Good afternoon, Annie.
Thank you. So how is this strike affecting health services in the north?
Thank you so much, and good afternoon to our viewers. Actually, the strike action is biting very much in the northern region. I visited almost all the major hospitals within the northern region, and I could see for myself that all the labs were empty. And I visited some of the wards, and some doctors were complaining to me off camera that it is affecting them a lot because when they request for lab tests, they are not able to get it from patients because the workers are not there. And I spoke to one lab officer who was around Tamale Central Hospital, who told me that they are having a lot of challenges with their eyes because what they do is it has to do with eyes, and government is not paying them risk allowances and many other allowances. But as a matter of fact, when you go through hospitals within the northern region, you realize that if something is not done, many lives are going to be lost due to this strike action, because many of the private laboratories within the northern region are really charging exorbitant fees, and many patients are not able to get their services from the private laboratories. I spoke to some patients who told me that they have been waiting the whole day just to get that service from Tamale Hospital, but even though the workers were around, they said they were not working because government is not heeding to their demand to increase their or to improve their condition of services. So the strike action, as a matter of fact, is biting very deeply in the northern region, and I think something needs to be done about it, else many lives are going to be lost to this strike action.
This is almost like, a halt in Medicare or medical care.
Yes, as a matter of fact, it's a whole process, and I must say that it's like it's truncating almost every service in the hospital, because many of the services provided by doctors and other workers at the hospital normally get their results from the lab technicians, which is not working as we speak. And it is becoming very difficult for patients to get these services from outside, that making the work of doctors and other health service workers in the hospitals very difficult. So it's a whole thing, and it is affecting and biting deeply within the northern region. I don't know of other regions, but as a matter of fact, the hospitals that I visited within the northern region, which includes Tamale Teaching Hospital, Tamale West Hospital, and Northern Regional Hospital, and many other small hospitals, clinics within the region, is really affecting patients and doctors, because according to one doctor, what is making it difficult for them is that they were on some patients and they have to run some tests to complete their treatment, but they are not able to do it because nobody is there to attend to the patients or to get them those services.
Dee Baba, thank you for your time. Meanwhile, the Health Ministry has appealed to Medical Laboratory Professional Workers Union to call off its strike and return to the negotiation table. The ministry acknowledged the union's demands for improved working conditions and expressed readiness to address them through negotiations. In a press release signed by the Public Relations Department at the Ministry of Health, stated that the government's negotiation team had reached agreements on most of the items proposed by the union.